The federal government designated May 11th as the official end, that is, of the COVID-19 health emergency, but the virus is still active and the leading cause of death in the United States among the elderly and the immunocompromised. So it's important to take precautions still, like getting vaccinated, masking, especially if you have a compromised immune system. And here to talk about these realities of navigating a post-pandemic life are Dr. Dori Segev, Director at NYU Center for Surgical and Transplant Applied Research, along with advocate and caregiver Tracy Shaw. Hey, thank you both for being here. Let's start with Dr. Segev, and now with the federal public health emergency for COVID-19 expiring, how will that impact those with weakened immune systems?
So as you said, the emergency is over, but COVID is still around. 10,000 hospitalizations in the U.S. last week, still a couple hundred people every day dying from this disease, and it's particularly impactful for those with compromised immune systems. The immunocompromised are now, while the rest of us are saying, thank goodness it's over, they're saying, uh-oh, there's going to be more COVID around, we're testing less, we're worrying about this less. But those with compromised immune systems need to protect themselves. They know they have higher risks, and they need to make an action plan with their doctor of a personalized way to stay protected.
And Dr. Segev, what do we need to know about the current risks for COVID-19 among the immunocompromised?
So throughout the whole pandemic, the immunocompromised have had a higher chance of getting COVID, and if they get COVID, a higher chance that that will be severe, cause hospitalization, cause them to die, etc. A much higher chance than the rest of the population. So for the immunocompromised, with new variants coming out, with the emergency declaration being over, they are at now higher risk of getting the virus and of getting bad disease from the virus. Now, there are some clinical trials underway to try to improve their protection, but right now they need to work with their doctors based on what's currently available for them.
Very good. And Tracy, how does this change how the immunocompromised community stays safe against these new COVID-19 variants?
In some ways, it changes a lot of things. In other ways, it doesn't change much at all, right? In the pre-COVID world, those living with compromised immune systems, autoimmune diseases, transplant recipients, cancer patients were always more attuned to the fact that they were at risk from diseases, germs that were out there. Now that, as Dr. Segev points out, COVID will be underreported and folks will be a little more cavalier around that. It's really important that they understand their resources, which is why we're so excited to be partnering with AstraZeneca on the Up the Antibodies campaign. That's where folks living with immune concerns, living with families, friends, colleagues, anyone who has someone in their life who could be vulnerable, which quite frankly is all of us. We all likely know someone who's a little more nervous now that the emergency is gone and the focus is on returning to life. They also want to refer to life. So we want you to go to uptheantibodies.com. That's where you will find patient stories, resources for support, the most up-to-date CDC and FDA information that will make sure that you have everything you need to take care of yourself. Of course, get vaccinated, wear a mask, wash your hands, and be smart about when you're with other people. It's just important that we all continue to work together to keep each other safe.
Well, Tracy, Dr. Segev, thank you so much for being with us here. And of course, for more information, you can go to our website now, and that's firstcoastliving.net.